Seniors, have you ever stood up and felt the room tilt? Just for a second? Or noticed that walking across uneven ground suddenly takes all your concentration? If that sounds familiar, don't brush it off. Your body is trying to tell you something. And today, we're going to listen to it together. Welcome back. If you're new here, this is your go-to place for honest, practical health information for people over 65. Today we're talking about something that affects millions of us, but doesn't get nearly enough attention: the early warning signs that our balance is starting to change, and just as importantly, what we can actually do about it. Here is something that might surprise you. Studies show that 1 in every 3 adults over the age of 65 has at least one fall each year. And for about 10 to 15 out of every 100 of those falls, the injury is serious: a broken hip, a head injury, a long recovery. But here is the hopeful part, and we really want you to hold on to this. Researchers have found again and again that most balance problems are not a life sentence. They can be slowed down, they can be improved, and some of the fixes are things we can start today, right at home. So let's walk through this together. First, why balance changes. Then, the warning signs to watch for. And finally, the easy steps that actually work. Before we talk about warning signs, it helps to understand what's actually going on inside the body. Because balance isn't just one thing. It's a team effort between 5 different parts of the body. And as we get older, each one of those parts starts to quietly change. The first is our inner ear. Deep inside the ear, there's a system that helps us sense movement and stay upright. After about age 65, research confirms that this system starts to work less reliably. Think of it like a compass that's slightly off. We're still standing, but our margin for error gets smaller. The second is the feeling in our feet. Our feet are constantly sending information to the brain. Where the ground is, how firm it is, which way we're tilting. But as we age, that feeling gets less sharp. Studies have found that older adults have much less foot and heel sensation than younger people, and that matters more than most of us realize. The third is our muscles, especially the ones in our legs, ankles, and core. These are what catch us when we start to tip, and without regular activity, they naturally get weaker over time. The fourth is our nervous system. The signals that travel from our feet up to our brain start to move more slowly with age. So our reaction time, the speed at which our body can catch a stumble, gets slower too. And the fifth, and this one surprises a lot of people, is medication. Research shows that about 1 in 5 older adults with balance problems can trace at least part of the problem back to a prescription drug, blood pressure pills, sleeping aids, antidepressants. Many of them have dizziness or unsteadiness as a side effect. So when balance starts to slip, it's rarely just one thing. It's usually a combination. And that's actually good news, because it means there are multiple places where we can step in and make a difference. 7 warning signs to watch for. Now let's talk about the signs. These are the things researchers and doctors say we should pay attention to. Some of them seem small, but taken together, they paint an important picture. Sign 1: you reach for things without even thinking about it. You grab the counter when you stand up. You put your hand on the wall when you pass through a doorway. You always use the railing, even for just 2 steps. This automatic reaching is your body compensating. It's doing its job, but it's also telling you it needs a little help. Sighing to uneven surfaces feel much harder than they used to. Grass, gravel, a slight hill, or a thick carpet suddenly demand your full attention. More than half of older adults with balance difficulties report that walking on uneven ground is one of the first things they notice. It's one of the earliest signs, and one of the easiest to overlook. Sign 3: standing up makes you dizzy. That brief spinning or lightheaded feeling when you get up from a chair or the bed. That's a drop in blood pressure that happens too quickly. It's very common, and while it often has a simple cause, it should never just be waved away as normal. Sign 4: your walking has changed. Are your steps shorter than they used to be? Do you walk more slowly, or with your feet a little wider apart? These changes often happen so gradually that we don't notice them ourselves, but they are among the earliest signs that balance is shifting. Our body widens its base of support to feel safer without us consciously deciding to. Sign 5: talking while walking is harder. If someone calls out to you while you're walking and you have to slow down or stop to answer, that's worth noticing. Our brains can usually handle 2 tasks at once. But when balance takes more mental effort, the brain has less room for anything else. Doctors sometimes call this a dual task difficulty, and research has confirmed it's a real, measurable sign of balance change. Sign 6: recovering from a stumble takes longer. We all trip occasionally, but if catching yourself now feels shakier, slower, or less automatic than it used to, pay attention. That quick catch reflex depends on fast nerves and strong muscles. When both slow down, recovery slows down too. And that's exactly when a trip becomes a fall. Sign 7: you've started quietly avoiding certain things. Maybe you take the elevator now when you used to prefer the stairs. Maybe you've stopped walking on that uneven path at the park. Maybe you skip certain outings because you're just not sure on your feet. This kind of quiet withdrawal is actually one of the most important signs of all. Because when we stop moving, we lose even more strength and confidence, and that makes things worse, not better. If any of those sounded familiar, even just 1 or 2, please don't feel frightened. Feel informed, because now we get to the part you've been waiting for. Now we will talk about 7 easy fixes that actually work. The research on this is genuinely encouraging. Balance responds to the right kind of attention. Here are 7 fixes, all backed by solid evidence, that we can start working on right now. Fix 1: try Tai Chi. This is the most studied balance exercise in the world for older adults. A major review that looked at dozens of controlled trials found that Tai Chi reliably reduces fall risk and improves balance in both healthy older adults and those who are already at higher risk. And the more regularly we practice, the better it works. It requires no equipment. It's gentle on the joints, and beginners' classes are easy to find online or at community centers. Fix to do simple balance and strength exercises at home. We don't need a gym. Standing on one foot while holding the counter, heel-to-toe walking down the hallway, slow chair stands, sitting down and standing up without using our hands. These kinds of exercises have been shown in large studies to cut fall rates by up to 30%. When done consistently, even 10 to 15 minutes a day makes a real difference. Fix 3. Take care of your eyes. Our vision is one of the main tools our brain uses to stay balanced. Studies show that when our eyesight is poor, whether from cataracts, an outdated prescription, or just dim lighting at home, our risk of losing balance goes up significantly. The fix is simple. Get a yearly eye exam, wear the right glasses, and make sure the rooms we move around in most are well lit. Fix 4. Talk to your doctor about your medications. This is one of the most important conversations we can have. Many common medications, blood pressure drugs, sleep aids, antidepressants, and others list dizziness or unsteadiness as side effects. Often, a small adjustment in dose or a switch to a different medication can make a big difference. Don't be afraid to bring it up. It's a very normal and important question. Fix 5. Pay attention to your shoes. The soles of our shoes affect how well we feel the ground beneath us. Thick, spongy soles can actually reduce the sensory feedback we get from our feet, making us feel less stable, not more. Health experts recommend low-heeled, rubber-soled, non-slip shoes for daily walking. And please, no socks on hardwood floors and no smooth-soled slippers around the house. Fix 6. Make small changes at home. Studies show that simple home modifications can reduce falls by nearly 20%. We're talking about grab bars in the bathroom, nightlights in the hallway, removing loose rugs, and non-slip mats in the shower. These are not admissions of weakness. They are smart, practical decisions that keep us safe and independent. Fix 7. Check your vitamin D levels. Vitamin D plays a real role in muscle function and nerve health, both of which matter for balance. Research has found that supplementing with vitamin D helps reduce fall risk in older adults who have low levels of it. The simple step: ask your doctor to check your vitamin D at your next blood test. It's a routine test, and low levels are very common and very treatable. When to talk to your doctor? We want to say this clearly. If any of the warning signs we talked about today are new, sudden, or getting worse, please tell your doctor. Don't wait for your next routine appointment if something feels off. Sometimes balance changes point to something that needs proper medical attention. An inner ear problem, a medication interaction, low blood pressure, or something else entirely. A doctor can order a proper balance assessment and refer us to specialists if needed. There are also physical therapists who specialize specifically in balance. And vestibular rehabilitation. That's a fancy way of saying they retrain the balance system. This kind of therapy is effective, safe, and often covered by health insurance. We are not meant to simply accept balance problems as part of getting older. We are meant to understand them, address them, and keep moving forward with confidence. Now that we are done with our conversation for today, let's bring it all together. Balance after 65 changes for 5 main reasons: the inner ear, reduced foot sensation, muscle weakness, slower nerve signals, and certain medications. The 7 warning signs are often subtle, but they're real and they matter. And the good news is that balance can be improved through exercise, eye care, safer footwear, small changes at home, a conversation with your doctor, and some attention to vitamin D. Here is our challenge to you today. Pick just one thing from this video, just one. Maybe it's starting a daily 10-minute walk. Maybe it's booking that appointment you've been putting off. Maybe it's finally putting that grab bar in the bathroom. One step taken consistently is how real change happens.